Hi guys, welcome back to my channel. Thank you so much for tuning in today. Today we're going to be talking about the 10 reasons why psychotherapy is not working. Either that's for you or somebody else, a parent, a family member, a loved one, a friend. This is a topic that you guys had voted on in the community section, and I think that this is a video that can be helpful if you are pursuing therapy and you're wondering why it's not working. So there's a couple of things that I want to point out, maybe some things that you haven't heard of before. So I think this video could be helpful, especially if you're in need of figuring out like what is going on in my psychotherapy or my parent's psychotherapy or my loved one, my friend. They're not getting it, And I'm sure a lot of people feel like therapy can be a waste of time. So let me just highlight some reasons in this video why it may not be working. I'm going to give you 10 reasons. Thank you so much for coming back to my channel. For all of you who are subscribed and participating, and for those who are new, I encourage you to hit that subscribe button so you can stick around with us and be a part of our growing and validating community. And in case you don't know me, my name is Tamara. I'm an internationally and board certified trauma therapist. I'm also licensed in mental health, and I specialize in treating children, teens, and families, as well as adults who are dealing with trauma in my private practice. Let's jump in. So psychotherapy, is a pretty emotional and psychological endeavor. I'll put it that way. It's quite the situation for a lot of people, because they have to go before the stranger and really hope that they are not only treated fairly and appropriately and ethically, but also healed and managed appropriately. And that can really put you in a place of vulnerability. You also have to air all of your internalized thoughts, feelings, behaviors, your fears, your vulnerabilities. You have to lay them all out on the table and become vulnerable. And that's not always an easy thing for people to do. We are used to, as a society, we are used to protecting ourselves. We're used to, kind of putting our best foot forward and really putting ourselves out into the world in a different way. When we have to be vulnerable and say, hey, look, there's a problem here, that changes things and it puts it on a different level. It says, I don't meet the social expectations of the world, which is that I'm strong, I'm independent, I can do what I want to do, I can make my decisions, I can control myself, right? I don't have hang-ups or problems. And I think, that kind of mentality really can get in the way sometimes of getting psychotherapy, or really get in the way of somebody really, making the best out of their treatment. Unfortunately, because of that social stigma and the way that the world has taught us to see things, and to also see mental health, a lot of people fail, for lack of a better word, in psychotherapy. So I want to highlight a couple of things that maybe you didn't know. And, a lot of you have spoken to me by email, by tweets. You have also spoken to me live through Facebook, through Skype. And you have really, laid this out for me, that this is how I feel, this is how I think when I go to psychotherapy, or when my mother goes to psychotherapy, or when my family member goes to psychotherapy, So I'm going to address some of that. All right. So the first reason why things may not be working so well in psychotherapy is because you may not need it. Yes, I said that. You may not need it. Some people do not, they just do not adjust to psychotherapy. It's not something that they necessarily need. It's not something that helps them get from point A to point B. Some people actually do better pursuing a pastor, pursuing a spiritual advisor, doing their own introspection, pursuing other people to help them, talking with family and friends, and really doing some introspection and some internalized evaluation on their own. Not everyone benefits from psychotherapy. And I think that's something my entire field, for the people who are kind of jaded in the field, they would probably be like, what? You just said that? Yes, everybody doesn't need psychotherapy. And as a matter of fact, there are certain cultures that totally reject psychotherapy. African Americans and Native Americans, the Hispanic, Latino, culture sometimes says, you know what, that's not for me. I'd rather go this way instead. And that may be helpful in most cases or some cases, but then in other cases, a psychotherapist really is needed. And that professional and objective help should be sought. Something can't work, right, if you don't need it. The next one. All right, cognitive dissonance. The whole idea behind cognitive dissonance in the field of psychology is that your beliefs, your theories, your thoughts do not align with what you believe to be reality. So your belief, your thoughts, all of that do not align. So here's an example of that. Let's say that you are struggling with a parent who is successful, loving, caring, engaging, and yet on the opposite side of that spectrum, you feel like there was some child abuse. Like you just feel something wasn't right about your childhood somewhere. Okay, let's say that's happening. Okay, and if it is, you need to deal with that. And if it's something that's on the inside of you that's there that needs to be dealt with, that needs to be dealt with. But let's say you're kind of struggling with that. You're kind of struggling with these misaligned things. This doesn't make sense, right? I have a good parent and I know they loved me and they were there for me, but yet I feel like there's some abuse. Like I was neglected here, or my parent was selfish here, right? Let's say you're struggling with that. That's cognitive dissonance. It doesn't align. Your thoughts, beliefs, reality, right? How you feel and think about certain things, it doesn't align. It's mismatched, right? Let's say this parent, they showed more positive traits than the abusive negative traits. So what you're likely to do is drop that negative side of things, and you're going to uphold the more positive view of your parents, because you can't align the two, right? You can't mesh the two. You can't marry it. And when you can't marry it, you drop the negative in favor of the more positive view. All right. Sometimes in therapy, that could be perceived as traumatic bonding. It could be perceived as denial. It could also be perceived as, kind of like some obsessive, thoughts and some anxious thoughts that, okay, maybe this happened and maybe it didn't happen. Maybe I was abused or maybe I wasn't abused, right? Or maybe I was, and I'm not really able to accept it, right? You could play ping pong like that for days in therapy, right? Sometimes that causes more harm than good, all right? So cognitive dissonance, your thoughts, feelings, the way you see things, they just don't align. And so, the reason psychotherapy isn't working is because you can't marry those two things, and maybe they're too painful to marry. Maybe it just doesn't click with you right now. Maybe you're not going to ever see it the way that you need to see it or should see it. So you're just kind of struggling with those misaligned pieces of your life. Okay, I'm sure some of you can relate to this. I've talked to some of you about this. The next thing that may cause psychotherapy not to be helpful is the theory of learned helplessness. Now, learned helplessness is pretty much the idea that you kind of learn based on past experience of failure or past experience of failed attempts at something, that it's easier to be helpless and go in the corner and hide and just give up than it is to push forward and be courageous and get through it, okay? So I talk about learned helplessness. If you need more information on that, right up here in this video, may be helpful to go back and kind of take a look at that. Sometimes if you're struggling with learned helplessness in psychotherapy, it can cause a major, major problem, okay? The next thing is racial trauma. I'm just going to put it out there on the table and say sometimes there are psychotherapists who are very far removed from racism and prejudice and discrimination. And they don't realize that some of the microaggressions, some of the cues that they are giving, the feedback, sometimes their own theories and ideas about things, sometimes their narrow views about things can really cause a client to just completely drop out emotionally. And it's like, why should I even go to psychotherapy if I feel like my very own therapist is prejudiced and discriminatory and giving off signs of microaggressions and a racist mentality? Even though they claim they're not, I sense they are, and the things they say like spins my mind a little bit, spins my head. If you are experiencing that, psychotherapy is not going to work because you're not connecting with that psychotherapist like you should. You should connect on every level, just about, right? Some of your beliefs, some of, how you feel about things. You should feel like you connect with your therapist on that to a certain extent. Culturally, you should feel like you kind of align, spiritually, you kind of align. You kind of have the same way that you kind of view life in a way. You know, you can have a very different therapist and still have a really good relationship, but there are some situations where you need to be somewhat aligned with your therapist in order for it to work. If you feel misaligned, that's an issue. Psychotherapy is not going to work. Okay. The next one that I have here is something known as the illusory truth effect. Okay, here it is right here on the screen so that you can kind of see that. The illusory truth effect. Now, here's what happens here. You have a certain belief, right? And you're not sure if it's true or not, but you strongly believe that it is. You may get people saying, that's not true. You know that's not true. Stop believing that way, right? You may have a lot of pressure to stop believing a way that you feel is true, right? You feel like your belief is normal. Nothing's delusional about it. Nothing's abnormal. What you're going to do is you're going to find every ounce of information and proof to help yourself prove that the way you see it is the way that it is. And that can get in the way of psychotherapy a ton, because you're not there to learn and grow and to change. You're there to prove yourself right. You're there to prove that what you have laying out on the table in the therapy room, or the way that you approach things, the way that you engage in life, whatever it may be, right? You feel that it is right. And hey, you have gone online and found the truth, the proof to prove it. That is almost like a form of denial. It's a defense mechanism. It says, I'm not going to look at other theories because I want to believe this way. That can get in the way of psychotherapy for sure. The illusory truth effect. All right. The next one is something known as denialism. Okay. Denialism. What you're going to do is find some way to verify reality, right? You're looking for some way to deny the truth and verify, or what's the other word that I could use? Kind of prove that this is reality, okay? Some individuals with delusions of grandeur, I talk about delusions right up here if you want to check that out. Some individuals with auditory hallucinations or visual hallucinations, they will seep into denialism, where they are looking for verifiable proof that the way they see it is the way that they see it, okay? So your goal, your mission is to verify that your way of doing it, your way of believing it, your way of seeing it is the right way. That can get in the way of psychotherapy. You have to be open-minded in psychotherapy, and if you're closed off and you can't explore and you can't think and you can't process, that's a problem. Therapy is not going to work. All right? The next thing is unresolved trauma. Now, unresolved trauma, it's really hard to delve into psychotherapy. You've got defenses, you've got barriers, you've got walls up, right? You've got fears, you've got uncertainties. You may even have internalized anger that gets in the way of you talking about the things that have hurt you, talking about the things that make you angry, you know? You may not be ready to face your trauma. Maybe going back to look at your trauma at that particular time in your life. Let's say you're into psychotherapy at a time where you just lost a loved one. Maybe that's not the time to go back into your trauma, right? Let's say you go to psychotherapy while you are going through a divorce and your therapist happens to bring up your trauma history and asks you if you want to explore it. You're going to probably be closed off because it's too much pressure all at once. So unresolved trauma can definitely get in the way of psychotherapy being helpful, okay? Because again, it's unresolved. So there's a certain approach that needs to be taken to kind of walk you through the process of facing that trauma. And if you haven't had, the right kind of coaxing and support and encouragement, right, prior to delving into that unresolved trauma, then delving into it at a time where you're not ready is going to be more detrimental. I'm going to also throw in here OCD tendencies. There are some individuals who are just very obsessive and they use compulsions to kind of lower that anxiety that they're feeling because of the way that they obsess. So let me lay this out. So let's say you're coming to psychotherapy and, you're obsessing over the fact that you broke up with someone. And you don't know if you did it the right way or if you did it in a way that could be harmful, but you just know that you broke up with someone and you don't know if it was the right thing to do. Let's say you've been obsessing about that. And what I mean by obsessing is thinking about it constantly without any pauses through the day. Right? The only time that you don't think about it is when you are distracted, when your head is buried in other things, right? Your compulsion might be to go online and type in Let's say, for example, did I break up with him for the right reasons? Okay, that's a compulsion, because what you're doing is you're saying, okay, my obsession is bringing my anxiety this high. Searching, did I break up with him for the right reasons? Looking for an article on it reduces that anxiety. If you are in that limbo with just about everything in your life, work, relationships, children, goals, whatever, that's going to really make psychotherapy difficult, because everything that your psychotherapist says is going to become almost like an obsession, and you're going to have to reduce that anxiety with some kind of compulsion. I don't know what it would be. But if you're in that obsession, compulsive stage in psychotherapy is going to be a little bit difficult, because that psychotherapist is going to have to unwire your obsession and figure out where it's coming from. And that can really take some time. It can get in the way. It can be a barrier. Okay? Really experienced and mature psychotherapists can manage that. Other psychotherapists are like, whoa, wait a minute. I can't deal with this obsession, and I certainly can't deal with your compulsion, because it's so repetitive and you can't see the rings that you kind of, create around yourself. Some psychotherapists back away from that, but really experienced psychotherapists can manage that. Okay, so keep that in mind. If you're in that obsessive compulsive loop, that can get in the way. All right. The next thing is vacillation. You're vacillating between one side and another side, right? It's like that OCD thing I just talked about, It's like you can't vacillate between one view and another when you're in psychotherapy. It's okay to explore. It's okay to consider multiple things. It's also okay to look at certain things so that you can understand yourself better, your life, or what's going on. But when you're vacillating, like, okay, I think today I'm going to be sober. I think tomorrow I'm going to go back to being a substance abuser. I think Tuesday I'm going to go back to being sober. I think Wednesday I'm going to go back to smoking dope. I'll smoke a little bit, not a lot, so I'm okay. And then Thursday I'm going to go back to not doing drugs. Like, you're vacillating. You're vacillating. And that can be really hard in psychotherapy, because psychotherapy has a goal, and the goal is to get you to a place of stability and to get you to a place where you can explore and be healthy and do okay. And if you're vacillating between multiple things, right, you're going to get stuck. Okay, you're going to get stuck, and the psychotherapist is going to get stuck too. Some psychotherapists terminate treatment at that point because there's no progress being made. You're just vacillating your way through psychotherapy, and that's not healthy. My personal way of doing psychotherapy with a person who's vacillating is to bring it up, give them proof, because a lot of times they'll come to me and they'll explain their life to me, their week, their month, and I'll listen, and then I'll say, okay, here's where you're vacillating. Here's where you're vacillating over there. Here's where you're doing it again. Do you see that too? And then once I can get that client to say, I do see that, then we can work with that. We can work with that. Hey guys, I don't know what happened. I actually went to look at my camera as I'm going through the video, and it completely, like, the battery died. Okay, so I'm gonna finish this video on my phone, and I'm so sorry, because I think the audio is gonna sound really weird, but I didn't want to just leave you hanging. So let me give you the last one. Okay, the 10th one is no grounding in reality. You have to have grounding in reality in order to get from point A to point B in psychotherapy. If you're not able to ground yourself in reality, and you live in a state of fantasy, and you live in denialism, then you're not going to make it from point A to point B. There's just no way. All right. So thank you so much for being with me today in this video. If it was helpful and if you found it interesting, please go ahead and give it a thumbs up. It helps the stats of the video 100%. And go ahead and hit that subscribe button if you want to stick around with us. And I will see you in the next video. Let me know if this is something that you have seen or experienced yourself. All right. I'll see you in the next video. Bye-bye.